Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our series of discussions around the COVID-19 pandemic, the way it's affecting us in Guyana, the way it's affecting us across the globe. Many of us have friends and families all around the world, and it's not just affecting us here at home, but it's affecting our friends and families far and away in foreign lands. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'm starting off this program today by wearing my mask correctly to cover both my nose and my mouth, but I'm going to take it off using the straps around the ears. There's no one close to me here, so I'm putting no one at risk, and I myself am not being put at risk. So the big thing in 2021, as we are in May now, is the vaccination program that Guyana has embarked on, and not only us here in Guyana, but across the region in our CARICOM brothers and sisters. We see that a lot of countries have started a vaccination program. Unfortunately, around the world, there are still about 30 plus countries that have not had a single dose of vaccine to give to their citizens. We are very fortunate in Guyana that we have had several 100,000 doses of vaccines procured and donated by our friends and our allies from around the world. The latest development is that Guyana just received another 38,000 doses of the AstraZeneca vaccine from the COVAX initiative, and we are expected an additional 60,000 doses of the Sputnik vaccine from Russia, and I believe this one was actually purchased for the citizens and residents of Guyana. So it is important that we recognize all of the strategies that are available for us to beat this pandemic and take full advantage of the opportunities that present themselves before us. As we know, India is one of the main producers of vaccines, but unfortunately, they are undergoing their own challenges at the moment. So the supply of vaccines produced in India may not always be available. So I urge my fellow Guyanese residents in this country to take full advantage of the vaccines that are available. Of course, it is still voluntary. It is still a choice that you have to take or not to take. But the vast majority of adults, that is 18 and over, can have the vaccine, and definitely there is certainly more benefits versus side effects or risks of taking these vaccines. We know that people have been getting the vaccines in Guyana. In fact, almost 160,000 doses of vaccines have been administered. I myself have been very lucky to get my second dose of the AstraZeneca a couple days ago, and I had absolutely no side effect from the second dose. No fever, no chills, no fatigue, no shortness of breath, no chest pain, none of that. I had a very good experienced nurse who gave me my vaccine, and I went right back to work the very same day and continued work the next day as well. And I believe this has been at least 72 hours since I got my second dose of vaccine, and I'm doing quite fine. And so I'd encourage you, and hopefully that gives some of you some confidence and take away some fears about your first and second dose. Both of my doses, of course, are AstraZeneca, and people have across the world, not just here, but there have been some noise and some chatter about blood clots being associated with the AstraZeneca vaccine. And yes, there are some link, but the risk of developing serious blood clots from AstraZeneca vaccine is less than 1 in 1 million persons receiving the vaccine. That is less than 1 in 1 million. Our entire population in Guyana does not reach 1 million. So it would be very, very uncommon or very unfortunate if we were to have blood clots developing as a result of the AstraZeneca vaccine, because we do not reach 1 million in our population, and the risk of developing blood clot is less than 1 in 1 million. People have had all kinds of fears, and some of it justified, some of it based on propaganda and misinformation circulating on social media and other platforms. Now, the most common side effects that people experience are things like chills, fever, pain at the site of injection, some fatigue, some headache. But all of these side effects, even though they occur, they are not unusual for vaccines, and they can be treated quite safely by taking Panadol or Tylenol or paracetamol, whatever brand you have. These are easily treated by these over-the-counter medications. And usually these effects do not last for more than a day, maximum maybe 48 hours. When I took my first dose, my fever and chills occurred on the night, and by the next day I was perfectly fine, back to normal. And of course I had absolutely no side effect from the second dose. So what is it about the vaccines that have made people scared? Well, there are several myths that have been associated with the COVID-19 vaccines. And remember, we have several types of the COVID-19 vaccines available, but in Guyana in particular, we only have 3 of the main types available. We have the AstraZeneca, we have the Sputnik from Russia, and we have Sinopharm from China. Now, these are all available for use and administration in Guyana, but outside of Guyana, there's also 3 main vaccines that are available: the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. All of the vaccines, all that are available in Guyana and those available outside of Guyana, all of them together have been shown to be 100% effective in preventing severe COVID. Severe COVID refers to admissions in ICU, being put on a ventilator, or even death. All of them have been shown to be 100% effective in preventing that. In fact, our own experience at the COVID hospital in Liliadal has shown us that there's been no ICU admissions for persons who would have had their vaccines at least 2 weeks before. That is 0 admissions. Even in the surge that we're having now, that sees us recording over 100 cases per day on average and having 14, 17 patients in the ICU, none of those patients have had their vaccines for 2 weeks or more. In fact, of a total of over 130 admissions since we started our vaccination program, we have had no admissions to the ICU who had a vaccine for more than a week. And that is encouraging, and that is in keeping with the data internationally, where people with the vaccines do not develop severe COVID. You can still develop COVID, but it's usually a mild or even moderate manifestation of symptoms, so that you do not end up in an ICU. It is still important for you to wear your mask, sanitize, wash your hands, and maintain social distancing after you receive your vaccine, whether it's 1 dose or 2 doses. It is still important for you to maintain those basic common sense recommendations, because even though you yourself might be protected, you do not want to be responsible for spreading potential infection to vulnerable people, because you do not know who you are interacting with. People may appear to be healthy, but many persons who look healthy have underlying problems that they themselves might not be aware of. Things like diabetes, kidney disease, hypertension, cancer survivors or even persons who are immunocompromised from one way or the other, whether they're taking medications that make them immunocompromised or whether they have underlying conditions that make them immunocompromised, things like HIV infection, things like lupus, etc. We have a number of those persons in our country that have these conditions. We do not know them just by looking, and if you transmit diseases and infections to these people, you can actually cause them to become severely sick and sometimes die as well. So some of the myths associated with the COVID-19 vaccines are, extreme and extraordinary, but people seem to think that this has been rushed and therefore it is not safe. Quite the contrary. These vaccines have been in development for quite some time, because while COVID-19 is new, the coronavirus that causes COVID-19 is not new. We have encountered it for more than 10 years before now. It was the cause for the SARS outbreak, the MERS outbreak. So scientists would have had at least 10 years in which to study this and to start developing vaccines and strategies for whenever it shows up again. The second thing that people are worried about is that it can actually change your DNA, that is your genetic makeup. And that is absolutely false. There is no DNA altering material contained in these vaccines. No DNA altering material. The closest genetic material that is involved here is RNA, the messenger RNA, in the two types of vaccines not available in Guyana, that is the Pfizer and the Moderna. Those messenger RNA type vaccines are used essentially to help your body produce spike proteins and then produce antibodies against those spike proteins. And remember from our previous many talks, the spike proteins are what is critical. They are critical for the virus to attach to your own cells and then become internalized. So if you have antibodies against those spike proteins, you reduce the chances of the virus attaching to your cells and then becoming internalized. The next great myth that people are worried about is that taking the vaccine could actually give you COVID. Well, nothing could be further from the truth, because none of the vaccines currently being used have any live viral particles. No live virus are included in the production of these vaccines, and therefore they are not part of the administration of these vaccines. So you cannot get COVID from getting a vaccine to COVID. The next thing is that people are worried that it may contain egg or fetal tissue, and it does not contain any egg protein or fetal tissue. These materials are not used in the production of these vaccines, none of them. The other concern that people have, and I've just been discussing this with some of my healthcare providers who are reluctant to take the vaccine themselves, is that they're worried about severe side effects. Well, side effects are possible, but it is very, very unlikely to have severe side effects. The most side effects people can experience are the ones that I've told you about. Some fever, chills, pain at the injection site, even some fatigue as well, either the same day or the following day. But none of this is different from any vaccine side effect that we have had. We've all had measles vaccine, mumps vaccine, polio, rubella, etc. All of those vaccines have some small side effects. But the bottom line is that they protect you a lot better than they actually expose you to risks. So the benefits far outweigh the risks, and that is why we continue to advocate that people should continue to get vaccines. The last big concern that people seem to have especially in women, that it makes you infertile. Well, there's absolutely no evidence that any of the vaccines contribute to fertility or lack of fertility either in males or females. So that is absolutely false. There is no evidence worldwide that these vaccines reduce fertility in men or in women. So I hope that we would have a better understanding now about vaccines, their role in COVID-19, and people are less afraid and less anxious to take their vaccines. Remember, if you have a question or any comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thanks again for joining me today.